Oh, about 15 years ago. Just came up in a physical exam that I was diabetic. Blood sugar was high. I didn't really pay that much attention to it. I kind of changed my diet and started exercising. Over the years, my feet, toes in particular, have lost feeling, which is kind of normal over time with diabetes. One day I came back from a walk and the underneath of the toe where I have the sore had just turned kind of white. And about 2 days later, it was like a big blister.
He had this ulcer for 6 months, and he's a 67-year-old gentleman. He's a very active guy. He walked every day, so for 6 months he was walking 4 miles a day on his foot ulcer. It was under his big toe on the ball of the foot, and it didn't really bother him, and he didn't take any action. Then he walked one day for 4 miles. The next morning he walked for a couple of miles, and that afternoon he was in septic shock in the hospital. Blood pressure 60/40, and literally had to have emergency surgery to save his life. If a few more hours had elapsed, he probably wouldn't have survived.
What they were worried about was the infection had gotten into the blood. It did not, because that can affect the heart. And they did some checks on the heart while I was in the hospital, test to be sure that didn't happen.
We evaluate their nutritional status, their diabetes management, and look at their circulation. We decide, based on what the wound looks like, how much to evaluate it. In some instances, it may be relatively superficial. In other instances, it's down infecting tendons, bones, and those things are much more serious.
They cut away dead skin around it, all the sores, and then they would wrap it up. Then I'd go back the next day and they put it in a cast, and they put a wound vac on it. It basically kept it dry, kept all the any liquid building up in the sore. Those first month or so, I was basically in bed most of the time. I'd get up.
He's been so very careful and very compliant, and he never misses an appointment. He does exactly what we tell him to in terms of seeing the consultants and getting their treatment. He's always done the right thing. That's made the difference.
I had to be healing a certain rate before they would try the dermagraft. First 2 weeks, it improved quite a bit, and everything healed up very quickly, about 3 treatments.
It's just a thin piece of material. We prepare the wound so that it will accept it and get a good bed of healthy tissue on an open sore, and then we will apply this product. Weekly, then the patient will come in and get it redone. Our practice, we use a total contact cast to protect it, so the patient doesn't have to do anything to care for this wound at all. All they have to do is come in once a week, and we will change it out and apply a new product, and typically in a period of 6 to 8 weeks, we will see the wounds heal.
This was the 6th treatment, so I'll have 2 more treatments. And the rate it's going, it probably will be healed. It should be healed.
Patients who have this kind of a problem are frustrated. Some of them are ready to give up. They may have had this problem for a long time, and they've talked to their friends, and their friends say, well, this is just the beginning. You're going to end up losing your leg. And it's very discouraging for people to hear that.
This kind of part of the dermagraft, they said they would be calling me once a week and ask me how things are going, if having any trouble.
It's given him hope. It's helped to reinforce that this is a problem that we can fix, that we can be successful, that we can get him back and get him healed.
I didn't know anything about a healing center, so I really didn't realize that. I just kind of relied on my own private physician to determine what needed to be done. What I learned from this is that's not the way to do it. You need to get really involved.
Well, he's nearly healed, and we've been using the dermagraft now for several weeks, and we're almost there. And so I'm optimistic that we will get his foot healed, get him back to living his life, and being, of course, a lot more cautious.
Oh, I feel great. It's a great product, just perfect product. I'm amazed that there's something out there. I've been explaining to people about what's going on, and then I told them about the dermagraft and how it works and everything, and everybody's just very interested and very surprised that there are those products out there now to help people to get over these wounds.
Dermagraft is a great product, but it can't stand alone. And I really applaud the company for having the caring that they not only want to sell the product, but they want to see us heal our patients. And they want to support us and support our patients in getting them better. They want to see us heal our patients. And that's what patient care is all about.